BSI, scene safety. I arrive on scene to find one patient. She seems to be clutching her chest. I'm not going to call for additional backup at this point. I'm not going to consider C-spine at this point because she seems to be sitting up. And my nature of illness seems to be something chest related, maybe respiratory related. So I'm going to approach the patient. Hi ma'am, how are you today?
Good.
What seems to be the problem? Why did you call us?
I'm having chest pain and I feel like I can't catch my breath.
Okay. Her airway is open and patent. Her breathing looks to be slightly labored. So I'm going to instruct my EMT partner to apply a nasal cannula at 2 liters. All right, ma'am, my partner is just going to put on some oxygen, maybe help you feel a little bit better, okay? She seems to be alert and oriented to the situation. So tell me more about what's been going on today. How long ago did this start?
About 15 minutes ago.
Okay, I'm going to check for any major bleeding or anything. I don't see any. I'm going to check her pulse. It seems to be rapid and thready. So you said this started about 15 minutes ago. Does anything make it better or worse?
No.
Does it seem to be spreading anywhere?
Down my arm.
Down your arm? So just your chest and your arm? If you had to rate this pain on a scale of 1 to 10, what would you rate it?
A 7.
A 7? Okay. With 10 being the worst pain you ever felt in your life. 7? And do you have any allergies?
No.
Okay. Are you on any medications currently?
No.
All right. Do you have any cardiac related or respiratory related history?
No.
Okay. And when was the last time you ate a meal?
Lunch today.
All right. I'm just going to listen to some lung sounds, listen to some heart sounds, okay? Take a deep breath for me. Take another. Take another. And one more. All right. I'm just going to listen to your heart real quick. Okay. All right. I'm going to instruct my EMT partner to take vital signs such as blood pressure, get a pulse ox, get temperature, as well as get cap refill. And then while my EMT partner is doing that, I'm going to put on a 12 lead. So I put on the 12 lead, and this is what I see. Okay, so just looking at the 12 lead, it seems like that they are having an inferior and septal wall MI because I see ST elevation in leads 2, 3, AVF, V1, and V2. But before I decide what to do about that, I'm just going to do a quick assessment of your arms and legs. Okay, and then the abdomen. Do you feel any pain here?
No.
All right, and I already listened to heart sounds and lung sounds. No pain in your back or your neck at all?
No.
And I do see that her neck leads are out a little bit, but they're not distended or anything like that. So just based off of all this information, I think that the patient is definitely having an inferior and septal wall MI, and my course of treatment for this would be to provide nitroglycerin, assuming that they're not allergic to it and that their blood pressure is adequate. So my EMT partner tells me that their blood pressure is adequate, something like 130 over 66, or just basically not below 100 millimeters of mercury for systolic blood pressure. So ma'am, have you taken any ED medications recently?
No.
Have you ever taken any nitroglycerin for any chest pain that you know of?
No.
All right. Would you be okay if I administered some nitroglycerin? It's going to help your chest feel better.
Okay.
All right. So I'm going to give her a sublingual tablet, which is 0.4 milligrams of nitroglycerin under her tongue. So I want you to put this under your tongue, and I don't want you to swallow or anything. I want you to just let it dissolve, okay?
Okay.
So I would administer that. And then afterward, I would reassess her vital signs. And at this point, we would get her in the ambulance, see how she's feeling. Did that help with your pain at all?
A little bit.
All right. If you had to rate it on a scale of 0 to 10, what would you rate it?
5.
Okay, that's doing better. So I would continue to reassess the patient, make sure that blood pressure was adequate, and then administer more nitroglycerin if I felt that it was needed.